In this video, we study a suprasternal view of the aorta in echocardiography. The suprasternal view is obtained by placing the transducer in the suprasternal notch, which is the depression at the base of the neck between the two clavicles, and directing the echo beam downwards towards the heart. The suprasternal view allows the visualization of the following structures: the ascending aorta and the aortic arch, which are the initial segments of the aorta that carries blood from the heart to the rest of the body. The main branches of the arch of the aorta, which are also visualized, are the brachiocephalic artery, which is the first branch of the aortic arch and divides into the right common carotid artery and the right subclavian artery. The next branch is the left common carotid artery, which is the second branch of the aortic arch and supplies blood to the left side of the head and neck. The left subclavian artery is the third branch of the aortic arch and supplies blood to the left upper limb. It may also be possible to see the descending aorta, which is the continuation of the aortic arch, which travels down along the spine, giving off branches to various organs. The right pulmonary artery, which is one of the two vessels that carry deoxygenated blood from the right ventricle to the lungs, is also seen in cross-section beneath the aortic arch in short axis view. In the video above, we can see the aortic arch giving rise first to the brachiocephalic trunk and the left common carotid artery, with the right pulmonary artery nestled under the aortic arch. In addition, it may also be possible to see the innominate vein and the left atrium also. The suprasternal view is important for studying the aorta because it can help and detect aortic aneurysms, which are abnormal dilatations of the aortic wall that can rupture and cause life-threatening bleeding. It can also detect aortic dissection, which is a tear in the inner layer of the aorta, creating a false lumen from where blood can flow and compromise blood supply to vital organs. It can also help detect aortic coarctation, which is a narrowing of a segment of the aorta that causes increased pressure in the upper body and decreased pressure in the lower body. This can lead to symptoms such as headache, chest pain, leg cramps, and hypertension. The close proximity of the arch of aorta to the right pulmonary artery can help detect patent ductus arteriosus, or PDA, which is a congenital defect in which a fetal vessel connects the pulmonary artery to the descending aorta, remains open after birth, causing abnormal shunting of blood between them and affecting cardiac function and oxygenation. It can also help quantify aortic regurgitation, which is a defect in the aortic valve.